Welcome to this explainer. Maternal health is this incredibly complex web. And today we're zooming in on a really critical condition that literally every expectant parent, and honestly their entire support network too, absolutely needs to understand. We're talking about preeclampsia. Now, my goal here isn't to scare you or induce any unnecessary panic, not at all. It's to empower you. We want to give you the structured clinical knowledge so you know exactly what to look out for. Let's just dive right in. So, what actually happens when a pregnancy develops a silent complication? I know it sounds a bit like the setup to a medical mystery, right? Because when we think about pregnancy complications, we usually picture these very obvious, undeniable signs that something is going wrong. But the thing is, biology can be incredibly stealthy. There are these unseen dangers that can just brew beneath the surface, completely undetected by the naked eye. Sometimes the patient doesn't even feel a thing. And that brings us to a specific, very serious condition that operates exactly like this, just hiding in plain sight. Section 1, defining the hidden threat. Okay, let's dive into this. 20. I really want you to lock that specific number into your memory right now. In the whole grand timeline of pregnancy, the 20th week is a pretty monumental milestone anyway. But medically speaking, it's the absolute crucial threshold for the condition we're looking at today. This 20-week mark is basically the timeline when this specific hidden threat usually decides to make its appearance. As we can see, preeclampsia is a pregnancy complication characterized by high blood pressure and signs of organ stress, usually popping up after that critical 20th week. Just take a second to really absorb those parameters. We're not just talking about, feeling a bit tired or the typical swelling that comes with carrying a baby. No, we're talking about a major systemic issue. It's high blood pressure combined with genuine, measurable stress on your body's internal organs, emerging right in the second half of gestation. That's the exact clinical definition you're going to want to keep in the back of your mind as we build out our understanding today. Moving on to section 2, how it impacts the body. Now we're getting below the surface. Think of preeclampsia kind of like a massive iceberg. The high blood pressure we just talked about, that's merely the tip. It's just the part you can see above the water. But the true danger, the real structural threat, is lurking way below the surface. Medically speaking, science doesn't totally understand the exact definitive cause of this condition yet. It's still a bit of a mystery. But researchers have pinpointed the primary suspect, and it's linked to the abnormal development of blood vessels right in the placenta. Now, the placenta is literally the lifeline between the mother and the baby. If the delicate vascular network there doesn't form correctly, it essentially trips a wire, setting off an alarm bell that echoes throughout the mother's entire biological system. And this brilliantly illustrates exactly what happens when those biological alarm bells start ringing. They echo loud and clear through the body's major organs, the liver, the kidneys, the brain, and the placenta itself. So this isn't just some localized discomfort. The body is going through widespread, severe internal stress. Your primary processing centers, which are the liver and kidneys, are under heavy siege. Your central neurological hub, the brain, is taking a direct hit. And the placenta, the baby's absolute vital life support system, is compromised. It's literally a full system alert. Which brings us to the ultimate stakes. Why does all of this internal stress matter so much? Well, first, because of those compromised blood vessels we were just looking at, preeclampsia directly reduces blood flow to the baby. That restricts the vital flow of nutrients and oxygen the baby absolutely needs to thrive. And second, if it's left untreated, it leads to extraordinarily serious complications for the mother. It essentially creates this severe, rapid domino effect of risks for both the mother and the baby if the condition isn't swiftly caught and medically addressed. Section 3, recognizing the warning signs. Let's shift gears from the unseen internal impact to the visible surface warnings. These are the surface warnings you absolutely need to know. High blood pressure is, of course, the clinical hallmark, but physically, you need to look out for sudden swelling of the face and hands. And note, this isn't just your run-of-the-mill late pregnancy foot swelling. We're also looking for severe, stubborn headaches that just refuse to go away, blurred vision, intense upper abdominal pain, and rapid, sudden weight gain. If you're pregnant or if you're supporting someone who is, these are your major red flags. They aren't just normal pregnancy aches and pains, okay? They're the physical body's warning sirens, basically crying out for immediate medical attention. Now, what's really interesting about this slide is it reveals the terrifying plot twist of this entire condition. On one side, you have those severe, blinding physical symptoms we just rapidly punch through. But on the exact opposite side of the spectrum, no obvious symptoms at all. Yeah, you heard that right. This is where the silent threat truly operates. A woman can be suffering from preeclampsia, her blood pressure secretly spiking, her internal organs under massive silent stress, and she might feel absolutely fine. It can be entirely, literally 100% asymptomatic to the patient. So the crucial point is this. Because these severe warning signs can be completely invisible to the naked eye, regular antenatal checkups are absolutely critical. This right here is the vital, life-saving resolution of our explainer today. You simply cannot rely solely on how you feel. Your medical provider has the exact clinical tools to see those invisible signs of organ stress long before you ever feel a single headache or notice a swollen finger. Attending every single scheduled checkup is your best, most effective, and honestly, most empowering line of defense. Which leaves us with this final, provocative thought. Preeclampsia can be utterly silent. It can hide quietly right beneath the surface. But your doctor's tools are not silent. Those tools are loud, they're clear, and they are highly effective at catching this hidden threat. So the question is, are you prioritizing your antenatal checkups? Whether you're expecting, planning to be, or supporting a loved one through their pregnancy journey, remember that showing up to those clinical appointments is the ultimate act of care. Thank you so much for diving into the critical world of maternal health with me on this explainer. Stay curious, stay highly vigilant, and keep learning.